All right, welcome back, everybody. The doctors at MUSC are innovators in stroke research, and Dr. David Bachman is here to share some information on the latest research findings and studies going on right here in the Low Country. Doctor, good morning to you. Great to have you here.
Good morning.
This is revolving around stroke. So first of all, we want to identify exactly what a stroke is and what happens to the body during a stroke.
Sure. There are different types of stroke, but the most common type of stroke is when there's a blockage to an artery that going to the brain, so that that part of the brain that depends on that artery for sugar, for protein, for oxygen, is deprived of that nutrient.
And one of the biggest symptoms of stroke, or something that happens afterwards, is a loss of speech. And you call that aphasia, is that correct?
Right. About 20% of patients who have a stroke may have aphasia as one of their symptoms.
And that would be?
That would be in difficulty with speech or language, especially word finding is particularly a problem for these patients.
Well, tell me about the new research studies going on and the new treatments that you guys are doing down at MUSC.
Sure. Speech therapy is still the mainstay of therapy for aphasia following stroke, and we certainly recommend people have speech therapy. But after 3, 4, 5, 6 months, it's hard to know whether speech therapy at that point is effective or not.
Yeah.
So we have a new treatment that's available for patients who are 6 months or more out from their stroke. We have direct current stimulation, mild electrical stimulation over the head that actually we think is stimulating brain cells in a way that they may be more receptive to speech therapy more than 6 months out.
So let me ask you, is this more identifying the neurons or parts of the brains that aren't firing, or this is more about sending that pulse to make sure that they are firing?
We're doing both. The patients initially are in an MRI scan, where we can get the MRI scan to show us what part of the brain is lighting up during certain language tasks. And then later we have treatment sessions planned where we put electrical stimulation over the head. Now this is no needles. We're not sticking needles in people's skull or in their scalp, but these are just electrodes that go over the scalp to put some mild electrical stimulation that may further enhance what those neurons can do to recover from aphasia.
Well, what are you guys seeing in terms of recovery?
Well, it's a blinded study, so we haven't broken the blind on the study yet. But preliminary data that was done by the group at USC and Columbia is very encouraging.
Wonderful. And again, this is not needles or injections or anything like that. It's more like those pads with the little wire that you stick just
Exactly. We've probably seen sort of lie detector tests, polygraphs, where they paste wires to people's scalp, or they have little wires on their fingers. It's a similar sort of thing. This is a very low voltage current, lasts for about 20 minutes, and while they're having the current applied, now some people get placebo. Not everybody gets the electrical stimulation directly, but everybody gets the speech therapy during this electrical stimulation.
It sounds like a wonderful thing, and you guys are seeking patients down at MUSC to go through this study.
We are indeed. We're looking for folks who are 6 months or more out from their stroke. It could be several years out from their stroke, but if they have mild to moderate aphasia, we're looking for them. We need help to really carry on this research.
Absolutely. And if people want to get in touch with you and be a part of this study, how do they do that?
They can call Sherry Davis at 792-2845.
Of course, stroke, we talk a lot about it here on Low Country Live with various organizations. What are the things that you need to notice right away, and what do you need to do right away if you think you are having a stroke?
Sure. It's very important that people recognize that they may be having a stroke, or somebody else may be having a stroke, because there are new clotbuster drugs that are available, but they have to be given within 3 to 5 hours of the onset of symptoms. So if somebody has sudden difficulty speaking, sudden paralysis, sudden weakness on one side of their body, sudden loss of consciousness, they should get to the emergency room immediately.
All right. Well, doctor, thank you so much for the tips. Again, if you want to be a part of that study and on the current edge of this great stroke technology, make sure you hit musc.edu or call that number on your screen. Doctor, thank you so much for coming.
Thank you very
and
much.
Best of luck with the study.
Thank you.
We hope you get all the best results. All right, much more Low Country Live after the break. Make sure you stick around, everybody.